Hi guys, it's Dr. Kid here. I'm currently a doctor that works at a clinic that specializes in adult ADHD, and in this video I'm going to tell you all you need to know about Atomoxetine or Strattera and whether you should start it for your adult ADHD. Atomoxetine or Strattera, which is the most common brand name for this medication, is a non-stimulant medication that's used to treat the symptoms of adult ADHD. It's typically used when a patient cannot tolerate any of the stimulant medications that are typically used. Typically when adults present to my clinic, they usually are presenting with symptoms of executive dysfunction. This includes issues in the areas of concentration, memory, organization, focus, and emotional regulation. The first-line treatment medication-wise for these symptoms are usually what we call the stimulant medications. This includes medications such as Adderall, Vyvanse, Concerta, Ritalin, and dexamphetamine. There are a subset of patients that cannot tolerate these medications, usually due to side effects. This is where atomoxetine comes in. It's usually the next in line after a patient cannot tolerate any of the stimulant medications. Atomoxetine comes in a range of doses, as you can see here, anywhere between 10 to 100 milligrams. Typically in an adult over 70 kilos, the initial starting dose for atomoxetine is 40 milligrams total a day. This can be increased by 20 milligrams a week up to a total dose of 80 milligrams. The dose can be given as a single daily dose or can be divided into 2 doses. If after 4 weeks on 80 milligrams there are still symptoms of executive dysfunction, then 100 milligrams can be tried. This is typically the maximum dose that's used. So what are the side effects? Well, the most common side effects of atomoxetine are dry mouth, decreased appetite, constipation, and nausea. So what are the contraindications to atomoxetine? Or who are the patients that should not use this medication? Well, this includes patients that have severe cardiovascular disease, patients that have uncontrolled hypothyroidism, patients that have a pheochromocytoma, which is quite a rare condition, patients that are concurrently using monoamine oxidase inhibitors. This class of medication is not commonly used nowadays anymore, and patients with narrow angle glaucoma. There are some other precautions you should consider when taking atomoxetine. Some studies of atomoxetine in children show a slight increase in suicidality rate. However, this was not replicated in adult studies with the same medication. This is just something to consider when using atomoxetine in patients that are at increased risk of suicide. Atomoxetine also has a risk of precipitating mania or psychosis. Therefore, caution should also be taken when using it in patients that have bipolar disorder or history of psychotic disease. So how does atomoxetine work? Well, the exact mechanism of how atomoxetine works in ADHD is unknown, but atomoxetine is known to increase the levels of certain chemicals in the brain, such as norepinephrine, serotonin, and dopamine. In patients with ADHD, the dysfunction is thought to be in an area of the brain known as the prefrontal cortex, which is an area at the front of the brain. And this is responsible for executive functions such as planning, attention, memory, and organization. How the stimulant medications work is that they increase levels of norepinephrine and dopamine in the prefrontal cortex. And because atomoxetine does impact on similar chemicals, this is probably how atomoxetine works in ADHD. So in summary, atomoxetine is typically only used as a second-line treatment when the patient cannot tolerate any of the stimulant medications. If you're interested in the other medications that are used for ADHD, see the links in the description below. I've done videos on all those medications. If you found the content of this video helpful, don't forget to like and subscribe to the channel. It really helped me out a lot, and I'll see you in the next video.